Hello, welcome to another episode of Arthritis and You, A Joint Journey. Today, we've got something special lined up, so buckle up because it's time for the deep dive. Let's give a warm welcome to our hosts, Arthur and Sarah.
All right, so today we're going to be diving deep into something that a lot of you have been asking about, rheumatoid factor tests.
Yeah, these tests can be a little bit confusing.
Oh, for sure, definitely.
Yeah.
And, I know a lot of people have questions about, what does it actually mean if you have a positive or a negative result?
Right.
So we're going to be taking all your questions today.
Absolutely.
And hopefully by the end of this, we're going to have cut through all the medical jargon and giving you guys a really clear understanding of what all of this means for you and your health.
Yeah, and we have this great video here by Dr. Amir Balu from Alberta Rheumatology, who breaks down all the details of the rheumatoid factor test in a really clear and easy to understand way.
Yeah, it's a really great resource.
Yeah.
One of the first things that kind of jumped out at me was that this test isn't like a surefire way to diagnose rheumatoid arthritis.
Right.
It's not like you take the test and then it says yes or no, you have RA.
Right.
It's more complicated than that, right?
Absolutely.
It's not a magic 8-ball.
It's not, yeah.
So what is it about the diagnosis of RA that means that it can't just be done by a blood test?
Right. Well, it's a really good point. And the thing is that doctors really rely on a physical exam actually talking to you and getting your story, because, these tests, they can offer clues, but to really get that full picture, you got to understand, you and what you're going through.
Yeah, absolutely. I think that makes a lot of sense. And I think it is definitely a little bit reassuring to know that doctors aren't just relying on a blood test.
Right.
But, I think a lot of times when people do get blood tests back and you see things, they can send you to a bit of a tailspin.
Oh, yeah.
And one thing that Dr. Balu talked about that I thought was so interesting was that you can actually have a positive rheumatoid factor.
Yes.
But not actually have rheumatoid arthritis.
Yes, absolutely.
So, how often does that even happen? And what else could be going on that would be causing that positive result if it's not RA?
Yeah, so it's interesting because up to 10% of perfectly healthy people can have a positive rheumatoid factor test.
Wow.
And that number can actually increase as we get older.
Oh, interesting.
Yeah. But what's even more interesting is that there are other conditions, aside from rheumatoid arthritis, that can also cause a positive result.
Oh, really?
Like lupus,
Okay.
Sjogren's syndrome,
Right.
even some infections like hepatitis B and C.
Wow.
And Dr. Balu even mentions that some cancers can cause it too.
Oh, wow. Cancer too. Okay, so that's a lot of different things that could be going on.
Exactly. And that's why it's so important to remember that a positive rheumatoid factor test doesn't automatically mean you have rheumatoid arthritis.
Yeah, that makes a lot of sense.
There are other possibilities to consider.
So, okay, a positive test can't confirm it, but what about a negative result?
Yeah.
Can you at least rule out RA if the test is negative?
Unfortunately not, and that's because the test isn't sensitive enough to catch every single case.
Okay.
So some people who have rheumatoid arthritis might still have a negative rheumatoid factor result.
Oh, so it's possible to slip through the cracks.
Right, exactly.
Okay, well, that kind of makes it seem like, what's the point of the test?
Right.
But Dr. Balu did mention another test called an anti-CCP test.
Yeah.
And I'm wondering, what's the deal with that one?
Right. So the anti-CCP test is actually much more specific to rheumatoid arthritis.
Okay.
So it's less likely to be positive in people who don't actually have the condition.
Oh, okay.
So it's like a more specialized detective kind of looking for very specific markers of rheumatoid arthritis.
Gotcha. So not a perfect tool.
Right.
But maybe a little bit more reliable than the rheumatoid factor in some ways.
Exactly.
Okay, so the video did say there are ways that these tests can be useful.
Yeah.
So it's not just about getting that yes or no for the diagnosis.
Right.
But when would a doctor actually use this information?
That's a great question, and you're right. It's not just about the diagnosis.
Yeah.
The rheumatoid factor can actually be very helpful in guiding treatment decisions once a rheumatoid arthritis diagnosis has been made.
Oh, interesting.
Yeah, so it can provide valuable information for how the disease might progress.
Okay, well, that brings up the next question, how?
Right, so let's say, someone is diagnosed with RA.
Okay.
The doctor will look at that rheumatoid factor result along with other things, like the severity of their symptoms, to get a sense of how the disease might behave.
So are you saying that like if you have a positive rheumatoid factor result, that might mean that you're going to need more aggressive treatment early on.
That's exactly right.
Okay.
It's all about trying to prevent damage to the joints and slow down the progression of the disease, right? And there's so many different treatment options available these days, from medications to lifestyle changes, even physical therapy.
Right.
So it's about finding that right combination for each individual.
And I know in the video, Dr. Bellew did mention that a positive RF result might make a doctor consider a stronger medication earlier on, like methotrexate.
That's right. Methotrexate is often a first-line treatment for rheumatoid arthritis, especially if there are signs of more aggressive disease activity. It basically works by suppressing the immune system, which helps to reduce that inflammation and joint damage.
Okay, so, I mean, that's actually pretty incredible that a simple blood test can give doctors all of that information.
It is, yeah. It's really remarkable how much information you can get from a simple blood test.
Yeah.
And, it really highlights why having that open communication with your doctor is just so important. They can take all this information along with your individual symptoms, your medical history, and really make the best decisions for your health.
And we want to empower you guys with information.
Absolutely.
But, nothing can replace the guidance of a healthcare professional.
Exactly.
So, take everything that you've learned here today. And then, go to your doctor, ask questions, and work with them to figure out the best way forward for you and your health.
Exactly. Knowledge is power, but it's most effective when you're working with your doctor.
Couldn't have said it better myself.
Yeah.
Okay, so we've debunked a few myths here.
Yeah, we have.
About the rheumatoid factor test.
Yeah.
They're not a solo act when it comes to diagnosis.
Absolutely.
And they can be positive, even if you don't have rheumatoid arthritis.
Right.
But we've also talked about how they can be really helpful in guiding treatment decisions.
Yes.
I'm curious, though, now that we kind of understand these limitations, how does a doctor actually use this information to make those treatment decisions?
Yeah, that's a really great question. So let's say, someone is diagnosed with rheumatoid arthritis.
Okay.
A doctor's going to look at that rheumatoid factor result.
Yeah.
Along with other factors like, how severe their symptoms are to kind of get a sense of how that disease might progress.
Okay. So it's kind of like you're saying a positive result might suggest that you need to be more proactive and more aggressive with treatment early on.
Exactly. It's about preventing that damage, to the joints, slowing down that progression of the disease.
And there are so many different treatments available now.
There are so many.
Yeah, it's really pretty incredible.
It is, yeah.
From, like you were saying, medications, lifestyle changes, physical therapy.
Yeah, it's about finding that right combination for each person.
And, I remember in the video, Dr. Bellew was talking about how a positive RF result might lead a doctor to think about prescribing a stronger medication earlier on, like methotrexate.
Exactly. That's right. Methotrexate is often one of the first treatments that doctors will consider, especially when there's a positive RF result, because it can really help to slow down that disease progression.
So it's almost like the RF is like a little crystal ball.
Kind of, yeah.
Giving doctors a glimpse into the future.
Exactly.
To help them make those decisions.
It's a powerful tool when it's used correctly.
Right.
And that's why it's so important, like we were saying before, to have that open communication with your doctor so they can explain what your individual results mean for you. They'll take into account your whole situation, your history, everything, and help you figure out what the best course of action is.
And I think it's important for us to remember, too, that we don't want to overwhelm anybody.
Right.
We want to give you the information.
Yeah. No, that's a good point.
But, this is a complex topic.
Yeah.
And if you're dealing with a new diagnosis, or even just thinking about the possibility of RA, it can be really overwhelming.
Absolutely.
So we really want to emphasize that this deep dive that we're doing today is really to just help people understand the basics.
Yeah, it's a starting point.
Right, exactly.
It's not meant to replace personalized medical advice. If you have concerns.
Talk to your doctor.
Exactly.
They're the best resource.
Exactly.
They can give you the most accurate information for your situation.
And, if you are feeling anxious or overwhelmed by any of this, reach out to a support group.
Right.
Connect with people who understand what you're going through. You don't have to go through this alone.
You don't. Yeah.
There's so many resources available.
There are. Yeah. Both online and in your local communities.
So I want to kind of circle back to something that we talked about earlier, which is that rheumatoid factor can be positive years before symptoms even show up.
Right.
What does that tell us about rheumatoid arthritis, and where do we go from here with that information?
That's the million-dollar question, isn't it?
Yeah, I mean, it's pretty wild.
It's fascinating, really.
Yeah.
The fact that we can see these changes in the blood, years before any symptoms
Yeah.
really speaks to how complex this condition is.
Yeah, and it makes you wonder, like, are there other early warning signs? Right.
That we're just not picking up on.
Exactly, that we're missing.
Yeah, not just for rheumatoid arthritis.
Right, for other conditions, too.
For other conditions, too, yeah.
Absolutely, and this is really the cutting edge of research right now.
Right.
Imagine if we could detect diseases, like, in their very earliest stages before they even have a chance to take hold.
That's like having a medical superpower, right?
It is, yeah. It's like predicting the future
Yeah.
and being able to change the course of these conditions before they cause real damage.
Okay, well, I think we've done a pretty thorough deep dive here
I think so, too.
into the world of rheumatoid factor.
Yeah.
Into the world of rheumatoid factor, and I think it's a good time for us to do a quick recap.
Yeah, good idea.
For our listeners, just to kind of make sure that we hit all those really key points.
Absolutely. Information's power.
Right.
But only if you can remember it.
Yeah, exactly. So, first and foremost, rheumatoid factor tests. Just one piece of the puzzle. When it comes to RA, okay, positive result doesn't mean you're doomed.
Right, exactly.
Negative result doesn't mean you're in the clear.
Right.
It's all about context, symptoms, your medical history.
Right.
And that good old-fashioned checkup with your doctor?
Absolutely.
All critical.
Yeah.
And even though a positive rheumatoid factor result can be a little bit scary,
It can be, yeah.
it can actually be helpful once an RA diagnosis is made.
Right.
Because it helps doctors understand the potential course of the disease and how to tailor treatment.
Yeah, it's like having a roadmap, right?
Yeah.
To guide you and your doctor as you make decisions about your treatment.
Okay, so for everyone listening out there,
Yeah.
if you've had a rheumatoid factor test, don't freak out
Right.
or start celebrating prematurely.
Exactly.
Talk to your doctor.
Yes.
Get the full picture. Work together to figure out the best way to manage your health.
Absolutely. Knowledge is power, but working with your doctor is really where it's at. Your doctor is your partner in all of this.
Couldn't have said it better myself.
Mm-hmm.
And I think this has really been eye-opening for me, too, learning about rheumatoid factor and how much we still don't know.
Yeah, it's really amazing, isn't it?
Yeah.
How much medicine is constantly evolving and changing.
Yeah. And on that note, we'll leave you with this final thought.
Yeah.
If rheumatoid factor can be this early warning sign, what other early warning signs might we be missing?
That's a great question.
Yeah.
And it's something that researchers are really looking into right now,
Yeah.
What if we could find those subtle clues
Yeah.
and intervene even earlier?
It gives me a lot of hope for the future of healthcare.
Me too. A future where we're not just reacting to illness,
Right.
but proactively shaping our health.
Exactly. Well, that's a wrap on our rheumatoid factor deep dive.
Yeah, thanks for joining us.
Thank you all for listening.
Until next time,
Keep exploring, keep learning,
keep those questions coming.
and we'll see you on the next deep dive. So we've covered a ton of ground here today. I almost feel like we need like a little summary just to tie it all together.
Our recap never hurts.
Right. Yeah, exactly. Okay, so number one takeaway, rheumatoid factor tests, they're just one piece of the puzzle. They can be positive even if you don't have RA, and a negative result doesn't give you a free pass.
Right. It's like, those tests, they give you some information, but the whole story, that comes from your symptoms, your medical history.
Yeah.
And of course, talking to your doctor.
Right, exactly. And I think one of the coolest things we talked about is that a positive RF result, while kind of scary,
Yeah.
it can actually be a really valuable tool.
Oh, absolutely.
Once RA is diagnosed, it helps doctors understand the potential path of the disease and make smart treatment decisions.
Right. So it's not just about do you have it or not. It's also about, okay, if you have it, what does that mean for you?
Exactly. Exactly. So to everyone listening, if you've had this test, don't jump to conclusions based on the result alone. Talk to your doctor, get all the information, and work together.
Yeah.
It's about making the best decisions for your health.
And remember, there's so much support out there.
Absolutely.
Doctors, support groups, don't be afraid to reach out and ask questions.
This deep dive has been amazing, honestly. Learned a lot, even me.
Same here. I always find it fascinating to learn new things.
And it really highlights that medicine is always changing, always evolving. New breakthroughs happen all the time.
And that's exciting, right? There's always hope for new treatments, new ways to manage conditions.
Absolutely. Okay, so one final thought for you all to ponder.
Okay, I like this.
If rheumatoid factor can be an early clue for RA, What other early warning signs might we be missing? Not just for RA,
Right.
but for other conditions. What if we could find those clues and intervene even earlier? It's a question researchers are exploring, and it gives me a lot of hope for the future of healthcare.
Yeah, it's exciting to think about the possibilities.
It really is. Well, that's all for our Rheumatoid Factor deep dive. Thanks for being here with us. And until next time, keep learning, keep asking questions, and keep taking care of yourselves.
We'll catch you on the next one.
This has been another episode of Arthritis and You, A Joint Journey, brought to you by the Rheum team from albertarheumatology.com, your trusted evidence-based suite of resources available 24/7. Straight from Alberta, but for folks around the world. Our hosts today, Arthritis and Sarah Upis, technical producer, John Ifan, and our executive producer, Stephen Cates. While we work hard to maintain the accuracy of our information, we accept no legal responsibility for any errors or omissions. Remember, always check with your own physician first. Join us next time for another Deep Dive.